In vitro fertilization is an assisted reproductive technology, also known as ART, and commonly referred to as IVF. In vitro fertilization is a process of fertilization by extracting eggs, retrieving a sperm sample, and then manually combining an egg and a sperm in a laboratory dish or petri dish. The embryo is then transferred to the uterus. And in vitro fertilization is used to help people who have blocked or damaged fallopian tubes, male factor infertility, including decreased sperm count or sperm motility, women with ovulation disorders, premature ovarian failure or uterine fibroids, women who have had their fallopian tubes removed, individuals with a genetic disorder, and unexplained infertility. I mean, just people who just can't get pregnant by normal sexual intercourse. And in vitro fertilization has 5 main steps, and step 1 is fertility medications are prescribed to stimulate egg production. Multiple eggs are desired because some eggs will not develop or fertilize after retrieval. So a large sample, or not large, but just quite a numerous amount of eggs must be retrieved, and a transvaginal ultrasound is used to examine the ovaries, and blood test samples are taken to check that the hormone levels are adequate. And step 2 is that the eggs are retrieved through a minor surgical procedure that uses ultrasound imaging to guide a hollow needle through the pelvic cavity to remove the eggs, and medication is provided to reduce and remove potential discomfort. Step 3 is that the male is asked to produce a sperm count, a sample of sperm, and which is prepared for combining with the eggs. And step 4 is a process called insemination, and in this step 4, the sperm and the eggs are mixed together and stored in a laboratory dish to encourage fertilization. In some cases, sperm is injected directly into the egg in an attempt to create fertilization if just keeping them in the petri dish does not work. And this is used in cases where there is a lower probability of fertilization, and this technique is called intracytoplasmic sperm injection, or ICSI, and in this case, just the one sperm is taken into the egg, not a sperm sample, for example, because it will have a lot of sperm. And the eggs are monitored to confirm that fertilization and cell division are taking place, and once this occurs, the fertilized eggs are considered embryos. And in the final step, step 5, the embryos are usually transferred into the woman's uterus 3 to 5 days following the egg retrieval and fertilization. And a catheter or small tube is inserted into the uterus to transfer these embryos. This procedure is painless for most women, although some may experience mild cramping. If the procedure is successful, implantation typically occurs around 6 to 10 days following egg retrieval. And in vitro fertilization has been a source of moral, ethical, and religious controversy since its development. Although members of all religious groups can be found on both sides of the argument, the major opposition has come from the Roman Catholic Church, which in 1987 issued a doctrinal statement opposing in vitro fertilization on 3 grounds. Ground 1 is the destruction of human embryos not used for implantation, and the possibility of in vitro fertilization by a donor other than the husband. That means that procreation, or the act of giving birth, is given the opportunity to occur outside of marriage, and then the severing of an essential connection between the conjugal act and procreation itself. And in vitro fertilization has also raised a number of unresolved moral issues concerning the freezing or cryopreservation of ovaries, eggs, sperms, or embryos for future pregnancies, which is considered unnatural and therefore has raised many ethical dilemmas by itself.